Hi everyone, my name is Asmita Ghimire and I'm a healthcare data analyst at the Center for Improving Value in Healthcare or CIVHC. Today, my colleague Emery and I will be presenting insights from our dental dashboard. I will start by sharing the background and methodology, and Emery will walk us through the dashboard itself. Oral health is a critical part of overall well being. That's why understanding dental care and utilization is essential to improving health outcomes, and that's what our analysis aims to support. The interactive dashboard, developed in partnership with the Colorado Dental Association, helps shine a light on how dental care is used, by whom, and where gaps in access may exist. Our goal is to promote a clear public understanding of dental care and utilization across Colorado and to help inform oral health policies that support more equitable and effective care for all Coloradans. To support this goal, we analyzed commercial dental claims data from the Colorado All-Pair Claims Database (APCD) covering the years 2022 to 2024. We included claims from Colorado residents and those with active dental coverage. We excluded denied or reverse claims to ensure accuracy. Emery will now provide us with the overview of the dental dashboard.
Hi everyone, my name is Emery Shekiro and I am a healthcare data analyst at CIVHC, and today I'm going to walk us through our new dental health dashboard. First, I want to show how to navigate to the dashboard itself. So here I am at the civhc.org website, and if I come over here to get data and public data featured focus area, I can then find the dental health analysis within our list of public reports. On the dental health analysis landing page, we have background information on the dental health analysis in addition to our use case examples and key considerations. You can also find our methodology and summary of findings over here to the right. At the bottom of the page, you'll find our dashboard, which has three primary tabs. We're going to start with the cost tab. The cost tab has three filter options. The first is year, which includes data years 2022, 23, and 24. I'm going to select data year 2024. And then for geography, we have statewide, rural, and urban. I'm going to select statewide. And lastly, we have our cost measures, which include the allowed amount, charged amount, health plan only, and patient only. I'm going to go ahead and select allowed amount. For definitions of these, you can use the information button above. Lower on the dashboard, you'll find two figures. The first figure is our table of cost measures by CDT codes. So all of our CDT codes are itemized here on the left, and they're broken out by average payment, 25th percentile payment, 50th percentile payment, and 75th. The definitions of these, again, can be found within our information button. This table is also used as a filter, which when selecting a CDT code, will populate our variation graph below. And now we can see the variation in allowed amount by commercial payer with the minimum, median, and maximum amounts. So now that we are familiar with the dashboard itself, let's talk through a potential example. So if I'm a provider, I might want to understand how my payments compare to peers. So let's look into imaging services specifically. I can type in a CDT code that I know of, such as D02. And now I have a list of all of my imaging services. To make this list even more clear, I can organize my view using the sort by function. The sort by function allows us to filter by code description in ascending order or by average payment low to high or high to low. I'm going to select high to low. And now I have a more organized view for my comparison. If I want to dig in deeper, I can select a CDT code of interest. So let's just select 4 radiographic images, since this is a service that we frequently use in our routine visits. And now I see the variation below, which I can use to inform further decision making. I see that the variation is quite wide, which might tell us there are potential differences in how insurers reimburse for the same type of service. All right, so next we have our demographics tab, and this tab is great for digging into our population and better understanding what services are utilized or where there might be gaps and disparities. On this page, we have 4 different filter options. The first, again, we have year, which includes data years 2022 through 2024. I'm going to select 2024. Next, we have geography, which includes statewide, rural, and urban. I'm going to select statewide. Next, we have demographic, which includes age group, race, ethnicity, and sex. I'm going to select sex. And lastly, we have our measure groups, which include our cost measures and utilization measures. For cost measures, we include the percent of the total costs, as well as our cost per person per year. And then for utilization, which I'm going to select here, we can see the percent of total utilization and utilization per 1,000 people. We have one more filter option to be aware of on this page, which is our trend measure filter. And here we will see all of our different cost and utilization measures broken out. I'm going to select our utilization rate in order to be consistent in our view. In order to further isolate a metric of interest, I can hover over one of our demographics. Here I'm hovering over males, and I can have that now isolated within my trend view. This gives me a clear idea that males' utilization was less than females throughout the year of 2024. If I wanted to dig into this deeper, I could again jump up to my filters and search by year and geography to see if this was consistent across all years and geographies. Another question I might use this page to answer is what services are typically utilized by males and females. For this, I can look over here to the right at my table of top CDT codes by utilization. And here I can see that periodic oral evaluations are most commonly billed for, indicating routine checkups are our most common reason to utilize a dentist. For more information about this chart and clear interpretations, I can use the information button as well. Our last tab to explore is our Trends tab, which allows us to dig deeper into our cost and utilization measures with an emphasis on time. So here our page automatically populates with all years of data and all geographies in order to make for easy comparison in our trend. Here you see 2022 through 2024 data with all of our geographies mapped out in view. If I wanted to look at a specific year or geography of data, I can do that as well by drilling down with our filters. So here I'm going to select 2024 and statewide data. And now I have 1 year of data mapped out into view and 1 geography statewide. Above on the page, we have our text band. I really like these summary numbers because they allow me to ground in the data of the trend and know other questions that I might be able to ask. So for example, in 2024, there were 1.6 million dental services delivered statewide. This equated to 485 million in total spending. There was a utilization rate of 78 services per 1,000 people, and the average annual cost was $285 per person. I might take this further by asking myself, how was that $285 per person distributed over the past year? Using my trend line below, I can dig in and see that it was relatively flat over the past year with the cost per person per month ranging from around $30 to $20. These are just a few examples of how one can leverage our dashboard. We're excited to answer your questions and hear about how you might be able to leverage this in your work. Thanks so much.